Hello all and welcome back to Science Made Simple. In today's episode, we're going to be discussing oral health protocols. This includes from brushing with hydroxyapatite to flossing, oil pulling, tongue scraping, oral microbiome balance, and the nutrition of fat-soluble vitamins that helps keep your teeth and gums strong. I will also discuss some of the key differences between biological dentistry and conventional traditional dentistry. Please remember that this is not medical or dental advice. Before making any changes to your dental routine, please discuss with your doctor and/or dentist. So what is biological dentistry? So biological dentistry looks at oral care through the oral systemic axis. So essentially it looks at the oral cavity, which is your mouth and your teeth and your gums, and how that can affect the rest of the body. It aims to prevent and reverse disease through environment, behaviour and biocompatible interventions. And there are four key main areas that biological dentistry really emphasises. The first being oral microbiome balance, minimally invasive treatments, reducing chronic inflammation, and supporting remineralization of your teeth and immune defense. So let's start with the first protocol. Of course, everyone should know it's important to brush your teeth. So we're just going to quickly take a look at manual toothbrushes versus electric toothbrushes. So the mechanism of how brushing your teeth works, it disrupts the plaque biofilm, which otherwise drives inflammation. So on your teeth, there's a buildup of what we call a biofilm, which eventually leads to plaque. And this can spread chronic inflammation throughout the mouth as well as the body. So when looking at the two, electric toothbrushes have consistently shown more effectiveness at plaque removal and gingivitis reduction. Brushing frequency and technique has also been shown to matter more than duration alone. So it doesn't matter how long you brush your teeth for, if the technique and frequency isn't there, it's not going to make a difference. So let's just quickly look at some stats. So electric toothbrushes reduce plaque by around 21% more after 3 months versus manual toothbrushing. And brushing twice a day minimum is associated with a lower systemic inflammation marker such as CRP, C-reactive protein, and this can be measured through blood draws. So as important as brushing is, flossing and interdental cleaning is just as important. So flossing and interdental cleaning is really important because essentially it gets to the spaces between your teeth that your toothbrush otherwise misses. This reduces inflammation and bacterial load and lowers the risk, therefore, of periodontitis and therefore systemic inflammation. So looking at the stats of flossing, so regular flossing is associated with a 25 to 40% lower risk of gingival bleeding and periodontitis progression. Interdental brushes may be slightly more effective than floss in some populations, so it's important to note. I would just like to emphasize the importance of ensuring that you're using a non-toxic floss. Make sure that your floss is made of either bamboo or silk and not forever chemicals or plastic. Similar to flossing, oil pulling has also shown some effectiveness in oral care. So oil pulling is a traditional Ayurvedic practice using classically sesame seed oil or coconut oil. I would highly recommend using coconut oil if you can. It tastes quite pleasant. You just put a simple teaspoon in your mouth first thing in the morning, swish it around your mouth for about 10 to 15 minutes, and then make sure you spit it out in the bin and not down the sink because it will clog your drain. Coconut oil is very high in lauric acid, which is very, very helpful for keeping the oral microbiome in check. So mechanistically, oil pulling may mechanically trap lipophilic bacteria and reduce bacterial adhesion. Some evidence also shows reduced plaque and gingivitis from oil pulling. So some randomized controlled trials show significant plaque index reduction after 2 to 4 weeks of oil pulling, similar to chlorhexane mouthwashes in mild cases. It's important to remember that oil pulling is not a substitute for brushing and flossing, but is a nice complementary tool. Now let's take a look at tongue scraping. So the tongue dorsum, which is the surface of your tongue, has a rough papillary surface where biofilm, food debris, bacteria and fungi can all accumulate, particularly the bacteria that festers on food debris. So removing that biofilm may reduce volatile sulfur compounds, which equals bad breath, bacterial load of carcinogenic or inflammatory species of bacteria, pro-inflammatory signaling, so local cytokines in gingival and cervicular fluid, and also binding sites for pathogens that can reinfect teeth and gums after cleaning. So it is really, really important for your oral health and oral microbiome to make sure that you're trying to keep your tongue clean and scrape off any food debris and biofilm. So it's important to tongue scrape at least once or twice a day. So now we're going to discuss toothpaste, which in the dentistry world is a fairly controversial subject. We're going to start with what I personally use, which is hydroxyapatite toothpaste. So hydroxyapatite is the primary mineral that makes up natural enamel and dentin. And I have previously talked about hydroxyapatite. So it remineralizes teeth by filling micro lesions and forming a protective layer that mimics natural enamel. Hydroxyapatite toothpaste have shown comparable efficiency to fluoride toothpaste for preventing cavities in multiple clinical trials. And unlike fluoride, hydroxyapatite is not systemically absorbed, making it particularly safe for children if swallowed. We're going to touch more upon that in just a moment. So some additional benefits of hydroxyapatite is that it helps reduce sensitivity, it protects against white spot lesions on teeth, and supports enamel recovery after acid attacks or eating acidic foods and drinks. It also works synergistically with saliva and minerals, so it doesn't rely solely on a chemical reaction alone. So let's now discuss fluoride and some of the concerns around fluoride. So fluoride does work short-term topically to protect teeth, but systemic exposure through swallowing toothpaste containing fluoride or drinking fluoridated water has raised concerns. So fluoride has been shown to cross the blood-brain barrier as well as the placenta, accumulating in brain tissue over time. High and even moderate levels of fluoride exposure are associated with lower IQ scores in several large meta-analyses involving children. Most studies are observational, but the signal is strong enough that multiple health agencies call for more action and further research. Chronic fluoride exposure has also shown to affect thyroid function, oxidative stress, and neurodevelopmental pathways. I would like to just now discuss another compound that it may be in many toothpaste and is certainly in mine, and that is xylitol. So xylitol is a sugar alcohol that does not ferment into acids in the mouth, meaning it doesn't feed carcinogenic bacteria. It increases salivary flow and pH, creating a more alkaline oral environment that favors remineralization of the teeth. Xylitol helps reduce mutant streptococci and other harmful bacteria. When used in toothpaste, which is typically around 10%, it has been shown to enhance cavity protection, especially when combined with hydroxyapatite. It also helps support gum health by lowering plaque scores and gingival inflammation. Now let's discuss diet, nutrition, and fat-soluble vitamins and minerals for oral health. So your oral tissues, so teeth, gums, and mucosa, are metabolically active, and they do require nutrients, antioxidants, and structural materials in order to repair, defend, and maintain integrity. So the main important fat-soluble vitamins are A, D, E, and K. So when looking at vitamin A, it plays a crucial role in epithelial health, mucosal integrity, and wound healing. Vitamins D and K, remember, work synergistically, so these look at calcium and phosphate homeostasis as well as immune regulation. And vitamin E is important for antioxidant protection and regulation of inflammation cytokines. Minerals are also essential when it comes to oral health. So for example, calcium, phosphorus, magnesium, zinc, these are all building blocks of enamel, dentin, and bone, and they buffer acid. So they support remineralization and modulate microbial interactions. Adequate hydration and saliva flow is also very critical. So saliva delivers ions, buffers pH, provides antimicrobial peptides, and physically flushes out debris. So some key findings and statistics. In a large US youth population study, a higher intake of fat-soluble vitamins, so A, D, E, and K, as well as phosphorus, was associated with fewer dental cavities. Vitamin E has also been considered as supportive in mucosal injury, particularly from chemotherapy. So a narrative review in 2023 on nutrition and oral mucosa, periodontium, highlights that deficiencies of fat and water-soluble vitamins and minerals can predispose to gingivitis, mucosal lesions, enamel defects, bleeding, and slower healing of the mouth. So here are some take-home points for you all. Hydroxyapatite is a clinically validated fluoride alternative with strong evidence for enamel protection and remineralization without the side effects of fluoride. Systemic fluoride exposure is associated with neurodevelopmental concerns, so topical use should be minimized, especially in children. Xylitol helps support enamel protection and healthy oral microbiota, making it an excellent addition to toothpaste formulations. Proper brushing technique, so tongue scraping, flossing, hydration, and nutrition will amplify toothpaste benefits. So as promised, I'm now just going to discuss the differences between biological dentistry and traditional dentistry. So let's start off with traditional dentistry. So traditional dentistry focuses on diagnosis, prevention, and treatment of oral disease within the mouth and surrounding structures. Its primary aim is to restore form and function through procedures such as fillings, crowns, root canal treatments, and using conventional materials like amalgam, metal alloys, and fluoride-based products. Biological dentistry, on the other hand, adopts a holistic approach that views oral health as integral to overall systemic well-being. It prioritizes biocompatible non-toxic materials, avoiding mercury, amalgam, and synthetic additives, and often incorporates complementary methods such as ozone therapy, nutritional guidance, and microbiome support. Its philosophy is preventative and patient-centered, aiming to minimize toxic exposure, reduce inflammation, and align dental care with the body's natural healing process. So it's an all-in-one system-based approach. So that wraps up this video. Thank you very much for sticking with me till the end, and I'll see you in the next one. And remember, that was science made simple.